All right, my friends, welcome back to Salt City Counseling. Once again, my name's Scott Carter. I'm a licensed therapist here in the beautiful state of Utah. And in this video, I'm going to continue my series on basically healing your own mental illness. I realize that these videos, by the way, might come with some controversy. A lot of therapists would disagree with me in making these videos. A lot of therapists might think that it is unethical to provide people with the means of exploring their own mental illnesses. I disagree. I just frankly disagree. I think we do the general public a huge disservice in general as mental health professionals by making people feel like, or causing people to feel like, that they are not allowed to engage in their own work without the help or guidance of a mental health professional. Now, obviously, I recommend that you do so. And the reason why, by the way, I'm including this on this video is because in this video I'm going to talk about trauma. And trauma is a big deal. It's a really, really big deal. And in fact, I'm probably going to do a couple of videos just specifically on trauma. At least two. I can think of at least two. And possibly and even likely could be more on trauma because it's a big deal. It's a very important topic. But kind of going back to what I was saying, I know that there are probably a lot of mental health professionals out there that might think that this is a bad idea, that I should not provide this insight and instruction and guidance to people. But I also honestly work very hard to try and be very realistic about what people need and what they're dealing with and what their resources are. And frankly, getting the people the support and the help that they need, accessibility itself is a huge, huge problem and a huge issue. And realistically, people need help and they need resources, and there aren't enough resources. And so I'm making these videos particularly to help provide that resource. Okay, so I will front load it by saying this. If you have trauma in your life, if you have significant trauma, please proceed with caution. Please be very conscientious of what your trauma threshold is. I'll get kind of more into that towards the end of this video. I'm going to touch on the types of trauma in this video and start building a foundation and a base on ways that you can help yourself kind of do some of this work on your own if you feel so inclined. Again, knowing that a lot of people just don't have the accessibility or right, they don't have access to resources that they need to do their own work. And frankly, people deserve help. They deserve healing. They deserve to find it. They deserve to just find some sort of resolution to their trauma in their life. Okay, so all of that being said, hang on, I got to scroll my notes down a little bit. Okay, let's get really honest about trauma. Now, trauma-informed care is a part. It's a kind of a movement in the mental health world that basically sort of supports the notion that a lot of things basically are based in trauma, and that a lot of people meet the profile for trauma before they meet the profile for other things. I frankly agree 100%. I think trauma-informed care is extremely important. For example, we might see a child who appears to be ADHD and can easily meet the profile for having trauma. I'm very generally reluctant to just diagnose or provide any type of treatment for ADHD without looking at other things first, primarily trauma. A child can look like they have ADHD when in fact they have trauma, or maybe they have ongoing trauma. A child, I've noticed that schools and teachers are very quick and inclined to diagnose kids with ADHD, but they don't know what's going on at home. If there's ongoing abuse at home, of course that kid's going to be anxious in school. Of course they're going to have a hard time focusing. And I don't think it serves them or does them justice to diagnose them with ADHD and just demand that they be put on medication. So all of that said, let's kind of build some foundation on gaining some insight onto trauma. So this particular series of videos is like basically healing your own mental illness. Trauma is a big one. Trauma is really, really big. Try to understand that it's going to take time and care and patience. You're going to want to tread carefully. You're going to want to take it slow. It's a game of inches. It's a game of inches. Sometimes it takes two steps forward and one step back, but at least you gained a step. There are days where you're going to feel like you're making improvements, and then there are going to be days where you feel like you have lost all of your progress and that there's no hope. So try to understand that working on trauma, it's a slow game. It's a game of inches, and that's okay, because you can get there. And it's a work in progress. Just give yourself permission to give it the time and care and careful nurturing that you need in the process. Okay, so accept that it can take a significant amount of time to work through it. Okay. One more, a little bit of disclaimer. None of this on here is medical advice. I'm not even providing therapy to you. It's on you to make the best decisions that you can for yourself. All of that being said, please be very, very aware. Awareness, mindfulness. Be aware of your trauma threshold. What I mean by that is you want to be very, very aware when you have reached your limit in your capacity for that time to talk about it, to explore it, to think about it, to write about it, to process it, or whatever. You have to be very, very aware. Your body's going to tell you when you've gone too far or when you're reaching that point. So listen to your body. Okay. Dissociation is going to be one of your number one things. Okay. Dissociation is basically a psychological symptom in which one starts to become detached from reality. It can come in a lot of different forms. So one of the first things that I want to build awareness here, if we're going to talk about trauma, is you want to ask yourself, do I experience dissociative symptoms? Do I experience dissociation? Some common things when it comes to dissociation. By the way, I'm sitting here thinking like this is gonna be at least 3 videos. That's okay. That's totally okay. I'm actually glad I can make them and provide some insights. But dissociation can look like this. Several things. Number one is no particular order. That you feel a little detached from reality. Your vision might become blurry. Your body might become numb. You might feel just totally detached and disconnected. Depersonalization is the type of dissociation where you are almost having an out-of-body experience. I've had some clients report to me that they that they have experienced a total detachment or exit from their body as a dissociative symptom. That's called depersonalization. Derealization is when things don't seem real. I've had some people explain this to me as though they are watching their life go by, sort of like a movie. It doesn't feel real. So those are 2 big ones. You may also be experiencing dissociation, like if you sort of have blackouts, if time doesn't seem linear. Without dissociation, your life there might be a linear timeline that you can recall, and when you're experiencing dissociation, then it's fragmented. It's in pieces. There might be missing time. There might be blackouts. So one of the first things that you want to do is examine whether or not you are experiencing dissociation. If you do experience dissociation, you're going to want to kind of get a feel for how severe it is. And I know that's a little bit tricky without kind of the help of a mental health professional. I'll do my best here. You may want to reach out to a mental health professional too if you want to get a handle on how severe it is. Try to pick a good one. Frankly, not all of them are good. That's just the truth. But what I would say to help you gauge that is, does it happen often? Is it frequent? Is it twice a week? Is it 3 times a week? Is it every day? Is it only a couple of times a month? Is it once a month? Is it maybe just a small handful of times per year? Okay. And if it's frequently, if it's happening multiple times a week or even every day, then there's probably some pretty severe and pretty significant trauma. In that case, what I would encourage you to try to find a good trauma therapist to work with. All the rave out there right now is EMDR. I don't love it. In fact, as time goes by, I quite dislike it. I don't like EMDR. It's very popular for trauma. Frankly, from what I've heard, at least 7 out of 10 EMDR therapists are doing it poorly, and it's re-traumatizing to a lot of people. A lot of people find EMDR to be very re-traumatizing, very distressing, and it actually makes them worse. And my biggest gripe and biggest grievance with the EMDR therapists is they refuse to take any feedback on this. They refuse to look at this. They refuse to accept that a lot of them are causing harm. They are. Because they absolutely are. It actually drives me up the wall because people, I even got a call a couple of weeks ago. Oh, we need EMDR. And I'm like, I don't do EMDR. Oh, okay, bye. And and I just think like, yeah, good luck. Good luck with finding a good EMDR therapist. Good luck not having them make it worse. There. Thanks for coming to my TED Talk. Time to slide that soapbox back under the bed. If you are experiencing significant dissociation, like several times a week, and all of that, to that degree, what you really want to do is focus very, very, very heavily on coping, managing symptoms, managing triggers, resourcing, using a lot of resources to help you cope and manage with a dissociation. I will do my best to provide some of that information here. Frankly, it's a rabbit hole. It's a big, giant can of worms. If you're in Utah and you want some help or insight with that, you can contact me. I'm not able to provide one-on-one help with this across state lines, unfortunately. Those are just the rules. Those are the rules, but I'll provide what I can in these videos. So don't forget to like and subscribe. This video is already going on 12 minutes long, and I've barely scratched the surface. But that's some initial information about dissociation and your trauma threshold. Get to know your trauma threshold. And understand, too, that when you're working on trauma, if you want to address your own trauma, know where your trauma threshold is and know that it's okay to approach it with caution, and that if you are reaching your trauma threshold at any point, it's okay to just back it away. Okay, so I'll give you a quick teaser for the next video. Partially what we'll cover in the next video is basically building your resource system, building a system of resources, and being able to turn to the right tools and effective tools on what is going to help manage those symptoms, what's going to help lower the distress. Because what we don't want to go too far into the dissociation because it's very distressful. And to some degree, it's okay to sit with it. But again, it's when you're approaching a threshold versus when you've crossed it. Okay, so I hope that's helpful. You can put some questions in the comments, or you can email me, scottc@saltcitycounseling.com. And don't forget to like and subscribe, share the video. That helps me out a lot. Help me grow my channel, please. I'm trying to get my mouse to the stop button. Thanks for watching. We'll see you next time.